The Health and Productivity Workshop, held at the Harbour Club in Rodney Bay, brings together key stakeholders from various sectors. Spearheaded by the NIC, the program seeks to equip businesses and government agencies with the tools to implement health workplace programs for their staff. Dr. Stephen King, chairperson of the NIC NCD Advisory Committee, emphasized the link between employee well-being and economic output.
So this is a launch of this program spearheaded by the National Insurance Corporation. And for the next 2 days, we're going to be looking primarily with businesses, but also with other government agencies to really build the capacity of workplaces to implement health workplace programs for the health of their staff. The reason being, our argument to businesses is that healthy people are productive people, which is good for business. So in other words, it is an investment. When you invest in the health of your workers, you're actually investing in your business, and the return is phenomenal.
The workshop, which continues Friday, will involve practical sessions where businesses can develop frameworks for their own health plans. Dr. King highlighted that the core focus is on productivity, underpinned by both the mental and physical health of the workplace.
The big thing is productivity, okay? And underpinning that is, of course, the mental health of our people, as well as the physical health of our people. So what we want to do is we want businesses to create policies and programs within workplaces which look after the people, inspire the people rather than burning them out, reduce stress on the workforce, actually encourage people to know how to deal with the chronic diseases that plague us. So how they should eat, how they should exercise, how we can give them space for that, how we can motivate them for that, how we can recruit them to make their own families healthier and their own communities healthier. In other words, we see the workplace as a really great place to further the lifestyle changes that are necessary for us to deal with non-communicable diseases. And the benefit to the workplace is that their businesses will thrive with a healthy workforce.
NCDs, which are responsible for a significant percentage of deaths in Saint Lucia, also contribute to poor quality of life and reduced productivity long before mortality. The NIC's initiative aims to improve both quality of life and prosperity by tackling these health issues head-on. The vision is for workplaces to facilitate comprehensive lifestyle programs for their employees.
Well, you see, you need to understand the root cause of non-communicable disease and the impact of non-communicable disease. Now, the problem with non-communicable disease is not only does it kill 82% of our people, it also reduces or creates a lot of poor health, poor life, poor quality of life, and poor productivity for many years prior to people dying. So, in other words, and a lot of expense. So what we are saying is that by addressing that, we're actually improving the quality of life of Saint Lucians as well as the prosperity of Saint Lucians. That's really what we are trying to do. So we expect all the HR departments of every workplace, every owner of every workplace, to now implement strategies that teach people how they should eat, what they should eat, how they should eat, the benefits of intermittent fasting, for instance, how they should keep their weight under control, how they should exercise, how they should think, how they should meditate to manage stress. So, in other words, we're talking about a holistic lifestyle program that we expect the workplaces to facilitate, to educate, and to give the space and strategies for every worker to implement.
The workshop's opening ceremony featured a keynote address by Dr. David Katz, a renowned American physician and author known for his work in public health and preventative medicine.